Viewers, today we're talking about these medical spas that provide IV therapy. These spas have nearly doubled between 2018 and 2023. And get ready for this, they're averaging about $1.4 million in annual revenue. Wow. They promise to get rid of your hangover, boost your immune system, maybe even reverse aging. But is this true? Do they really live up to this hype? Well, we're going to find out today on Spot On. Let's go back here. Okay, I'm back, and I brought someone that's going to help us out with this whole issue of medical spas and IV therapy. Her name is Dr. Jessie Seiler. She's got a PhD and an MPH. She's a senior associate at the Center for Science and Public Interest and an affiliate assistant professor in the Department of Epidemiology in the University of Washington's School of Public Health. And she also worked for the CDC, the Centers for Disease Control. It's like, woo, isn't she hot stuff? I got her on here because she wrote this terrific article. I loved it, all about medical spas and IV therapy. And it's called Mixed Bag. Get it? As in IV bags. And that's when I read this and I said, oh my goodness, come on and let's figure this whole thing out. So with that, Jesse, thank you so much for coming on Spot On.
Yeah, thank you for having me. What a great time. I'm excited to be here.
Well, I'm excited because I have been seeing these medical spas popping up all over the place. And of course, we have celebrities on TikTok and Instagram going to these. I see the IV bags, and, it reminds me of IV bags is like, oh my goodness, I'm back training in the hospital here in Boston. I'm like, what are you doing with IV bags? And so tell us, what are medical spas?
Yeah, great question. What a great starting point because you think you know what they are, right? You hear the phrase
Right.
medical spa and you're like, ah, yes, a spa that is somehow also medical. But actually, these are non-hospital locations that offer, among other things, IV therapies. And those other things might include dermatological services like Botox or laser
Hmm.
hair removal, services that claim to tighten your and lift your skin without surgery, all sorts of things. But really, the big one is IV therapies. So they're generally just places that offer these sort of this idea of wellness, this idea of relaxation with this sort of little sprinkling of something medical happening as well in these forms of IV therapies.
So it basically can be like a storefront, right?
Yeah, yeah, they can be a storefront. They don't have to be, even though they have medical in the name, they don't have to have any of the sort of general trappings we usually associate with
Right.
a
Right.
medical facility. So,
Right. And that's really interesting because, there I know what spas are, mani pedi,
sure.
I get that, massage, that's fine. But when I hear medical spas, like I get medical, like it gets more serious. But really, what's different between medical spas and spas?
Yeah, that's a great question. I think that medical spas have this sort of air of what you're saying, sort of this is a medical procedure.
Mm,
When you come here, you're going to be seen by a medical professional. You're going to get the type of treatment instead of, we might think treatment instead of service
mm-hmm.
that's, conducted, that's given to you by a medical professional. Likely your insurance is going to be involved in some way. And of course, a lot of that just isn't true, right? So these aren't typically facilities that are overseen by an MD or someone with a sort of healthcare practitioner training. And insurance typically doesn't cover what you can get access to at a medical spa.
Wow. Okay, so why do you think these have become so popular?
Yeah, and you're right to say that they have become popular. This is kind of a recent boom. A report from the industry said that between 2018 and 2023, the number of medical spas in the United States has nearly doubled from over 5,000 to over 10,000. So
Whoa.
yeah, we're
Yeah.
just seeing a boom in these. I think in part because they can largely evade federal regulation. So they're pretty easy to start, among other things. There's just fewer hoops they need to jump through to actually get going than there probably should be. I think, in this sort of uneasy post-peak pandemic world, we still have
Mhm.
a couple related problems to the medical system. One is just some medical mistrust. People are maybe not don't have a trusting relationship with a doctor or a healthcare practitioner, their primary care
Hmm.
practitioner. Others might just have trouble getting an appointment. So people are maybe thinking like, oh, I'm not feeling my best. Like, I guess I could go to urgent care, or I guess I could, but I'm not going to be able to see my doctor for the next 4 months. Well, maybe all it'll take is an IV therapy. There's also, people who need these dermatological or want these dermatological services might have trouble making an appointment too. So I think also, what we're doing right now, right? A lot of us spent a good chunk of the peak pandemic era staring at our faces on Zoom, which maybe for some people was not, a comforting
Right,
experience. So we might, explain the sort of focus on the aesthetic services that way as well. But there's also this element of like wanting a ritual of self-care, of just like
right.
something's a little wrong. I feel a little off. I want to treat myself. Maybe these IV therapies are a way to meet some of my sort of wellness goals without having a whole trip to the doctor. And of course, you nailed it. It's social media, right? Influencers can say whatever they want about these treatments.
Right. And these are not cheap, are they, Jesse?
Not at all. Yeah, not at all. We
So,
found ones that range from hundreds to thousands of
oh boy.
dollars. Yeah,
Oh boy.
yeah.
Oh boy. And they're making like all of these claims. Like it's like
Mhm.
give us some claims that they're saying that, come here for this IV therapy and you will feel blank.
Yeah, so some make these very general claims about aging slower, or about
Mm,
being able to prevent unnecessary aging was a word I saw a lot in reviewing these websites. Some are about losing weight. Some appeal to athletes or
mhm,
maybe the sort of weekend warrior type of athletes among us who, want to be better athletes. Some are even more general. They're about beating the cold or getting rid of a hangover, which of course is just going to go away on its own if you give it
mhm.
time. So there's this huge range. We even see really general claims about if you want to optimize your mind and body, here's a treatment for that. And of course, how would I even know that was working? Like what does optimization feel like? But yeah, so they make a wild set of claims.
And this is here we go again. I remember this during COVID where the most Googled word or words during COVID was immune system.
Oh
People were
yeah.
doing anything to boost their immune system as they were hearing about the neighbors dying or family
Oh
members.
yeah.
And so this whole thing of, putting in an IV to get hydrated I understand that in severe cases, in the hospital, but for a person who can just drink fluids, I'm not. I mean, we're taking this all to an expensive extreme. And what does the
Yeah.
science really say about all this?
Yeah, you're really right. I think a lot of this comes from this fear that we maybe never really processed. This is not my specialty. I'm an epidemiologist, not a psychiatrist, but
Mm,
maybe we never really processed what we all went through during that really extreme period of the pandemic. Maybe we never had a chance to grieve and sort of think about how these events changed our relationships with our own bodies. So, yeah, and in terms of what the science says, these health claims, a lot of these IV therapies work out to be just essentially huge doses, mega doses of various vitamins, often B and C. And there's just not evidence to suggest any benefit to most people. So basically, if you don't already have a severe vitamin deficiency, like scurvy, right, which is a deficiency of vitamin C, or if you don't have a critical illness or specific medical condition, like if you're maybe on hemodialysis due to treatment for
mhm,
kidney disease and
sure.
therefore having some issues with absorbing vitamins B and C. So if none of that really applies to you, if you're just kind of going about your day and like feeling a little tired, feeling a little run down and stressed, these just aren't for you. There's no evidence to suggest that they're really going to do anything to you. And of course, we know that these vitamins, you can get those from a balanced diet, right?
Right,
There's a much cheaper way to meet your goals here. And it's drinking sufficient water, getting enough sleep, eating a balanced diet. If you can't eat a balanced diet, you could try an oral multivitamin.
right.
All of that is a lot cheaper than these IV therapies work out to be.
Yeah, absolutely. And we have done spot on episodes about multivitamins and
Yes.
I'm really pro vitamins based upon what your needs are. And there's a lot of
Yeah.
pregnant women
Yeah.
need a
Yes.
vitamin supplement. Older people may need it based upon what their dietary intake. But we're talking much different, a dollar a pill, maybe even not even
Yeah.
that much, versus hundreds or even there's thousands of dollars is just unbelievably mind-boggling. And when you said that there's like not even a medical person that's potentially in the building,
Yeah.
so when you said the FDA is not overseeing explain who's overseeing. Is anybody overseeing this?
Yeah, that's a really great question because of course you'd want someone to be involved. You know, with our doctors, with our
Hmm.
we're nurses, nurse practitioners, there's this licensing process. You can there's a sort of standardized procedure for like, yes, you have the training, you are going to be able to see patients, and we're comfortable with all that happening. We trust you to do that work. So you'd think that with something called a medical spa, there would maybe be also a similar procedure just to make sure that what you see, what you hear is what you get, and then it's going to end in a good result for you, and there aren't any unnecessary risks. And yeah, you're right. There's just not that type of oversight. And starting and thinking about, well, who oversees these medical spas, who's actually on site? You'd think they'd be doctors, but as we
Right.
said, they're just not, right? They're not even people with extensive relevant training. According to the American Medical Association, 70% of these medical spas have no affiliation with an MD at all.
Wow.
And so what we're seeing is people with some technical training, but just not rising to the level of what they need. So they're mixing, often with IV therapies, they're actually the ones compounding these mixtures. They're doing the mixing themselves on site sometimes, or in a different location and bringing these IVs to the site. So yeah, it's the lack of oversight is really astonishing and the sort of site level.
If you're listening to this rather than watching this on YouTube, you're just seeing my mouth open and not be able to speak because what's going through my head right now is, oh my goodness gracious, the problems that you could
Yeah.
see. Like if you're on certain medications and then you're getting IV of vitamins that may interact with those medications, I can just see that this is a bad ending to a bad movie.
Yeah, exactly. And especially because, we have complicated medical issues and we
Oh,
have,
yes.
we're lucky, those of us who can get in to see a doctor regularly, to have someone who understands, okay, you've been on this medication for a while. Here's what that means for, how your liver is doing or what you should be thinking about for your kidneys, just whatever it is. I'm not a doctor,
Hmm.
and I'm amazed by the people with that knowledge. But that is specialized knowledge that requires a lot of training and a lot of experience. So for people without that training to be willing to offer these services is, yeah, it could really put people in harm's way. And we do see some harms coming from this, right? This is not a no risk thing. It's not just swallowing a glass of water in the morning so that you feel hydrated. There are risks involved.
So can you explain what some of these risks may be?
Yeah. Yeah, sure. I mean, infection's always a risk, right?
Yeah,
Anytime you're
that
doing
was the first.
something like
I have to
that.
tell you something. That was the
Yeah.
first thing I'm thinking about. Like, who is this person putting this IV in my arm?
Yeah.
Like that was like I'm like sitting there. Oh gosh. Good. Sorry.
Yeah. Yeah. No, it's a good first thing to be worried about because it's very, you're seeing it happening and you're thinking like, okay, like they used an alcohol swab, is that enough? And infection at the site of an IV placement, it doesn't necessarily stay there, right? It can lead to sepsis, it can lead to bloodstream infections. If you have repeated IV administrations, that can cause inflammation, bruising, that can cause vein damage or collapse. So even these sort of physical things that can happen over time are potentially an issue. And then, of course, high doses of vitamins, even thinking before, well, what if people are on certain medications? High doses of vitamins have been associated with kidney problems, arrhythmias, blood pressure problems, GI problems. There's all sorts of things that can happen in your body if you're really taking these things at a very, very high dose. And then, one of the things that I think we don't really appreciate enough is, well, what if people are going to an IV therapy spot and getting this sort of service and therefore pushing,
Mm.
like pushing out, like, okay, something's wrong. I'm not feeling my best. Like this thing hurts in a new way. This feels odd in a new way. I should maybe go see a doctor or like my primary care practitioner, whoever that is. So if these services are diverting people from the actual medical care that they need, from the screening, from the testing, from the routine care, that's also a pretty considerable problem because that could lead to any number of things.
Oh, absolutely. You always hear these stories that people delayed, going
Yeah.
to the physician and delayed the diagnosis of, fill in the blank, whatever it is. And gee, if
Yeah.
they would have just caught it earlier, it would have been less complicated. So, again, this whole, not only the expense and the risks of it, but I mean, minor risks, as I wouldn't say minor infection risks, but like in this
Yeah.
severe, that delaying is really, really a real problem to it. I also want to say to people that people often think that vitamins are benign. Like,
Yeah.
oh, there was an old saying, back in the 80s that, oh, water soluble vitamins, you'll just pee them away. And, Americans have the most expensive urine in the world, blah, blah, blah. Yeah.
Yeah.
Yeah, but, yes, but even water soluble vitamins can have at high levels, consistent high levels, GI disorder, other things going on. We know fat soluble vitamins can be stored and really have toxic effects. And so don't think that they're just poo-pooing this. And I think people think that they are benign and not necessarily based on the amount of that you're taking of these and the chronic use of them. So again, not something that is recommended or should not worry about. Um,
Yeah.
the
And just to build on that really
Sure.
quickly, I just think that's so important because one of the assumptions you make in thinking about a spa is like, oh, this couldn't possibly
Right,
be harmful, right? It's like getting a mani-pedi before a
right.
friend's wedding or to treat yourself. It feels like it's on that level of interaction. So then pointing out like, hey, there are actual risks to this. This is something you want to talk to a provider about. That feels incongruent with like what people are actually experiencing. And it's all part of the marketing, right? Like yeah, it's upsetting.
What should you look for, like if you want to go to these? Because I don't know if these medical spas, besides giving IV therapy, they may also give other things that like a massage, or they may give a facial. I don't know because I've not been to one. But what do you need to be looking? What kind of questions you need to be asking?
Yeah. I mean, I'm not a doctor, and I think
Hmm.
for me, I would definitely want to talk to whoever my primary care practitioner
Hmm.
is, whether that's a doctor or a nurse practitioner,
Hmm.
before starting any of these
Yeah,
things.
yeah,
Massage, yeah, that's generally regarded as safe, right? But something like Botox or something like these sort of techniques to lift and firm your skin, that to me starts to cross a line into, I'd really want to talk to a dermatologist about all all of these potential treatments and whether they're actually necessary. So one thing, if I had a friend who was looking into this, I might say like, what did your primary care practitioner say, and what are the things they said to look for? Another thing to flag for people is the insurance question. Are you going
yes.
to be paying fully out of pocket, or
Hmm.
is this something that your insurance is going to cover? Because that's another, these IV therapies, these are not something uh, that insurance companies are going to pay for the most part.
Right. It's funny, not funny, but it's interesting. If you have an IV in a hospital, for goodness
Yeah.
gracious sakes,
Yeah.
you got in there for a reason and you are sick
Yes.
and you need an IV. Insurance is going to be working with the physicians there, but outside to say, I got an IV because I want to look 10 years younger or get hydrated,
Yeah.
I can't imagine that insurance companies are going to say, sure, we'll cover it.
No, yeah, and that was actually one of the findings in this recent JAMA paper from CSPI's executive director, Peter Lurie. One of the things they did in that paper was look at, whether insurance actually is going to pay for these. And yeah, this is just,
Yeah.
yeah, there's not coverage there. So
Right. And I don't know what they're saying, but check that out before you go there, and then all of a sudden get
Yes.
a bill for $1,000
Yeah.
when you could
Yeah.
have just been drinking more water during the day. You know what
Yeah.
I mean? And
Yeah.
and if that was what you thought your issue was here. My goodness gracious. Okay, I can't thank you enough for writing this because I have to tell you something. I've seen these all the time. I see mostly on social
Yeah.
media these people hooked up to these things, and I knew
Yeah.
with my health background that this is not something you're going to do outside the hospital unless it's in some kind of like dialysis clinic or something where
Yeah.
it's done that. But I think so important to find out who is providing this service. What are their
Yes.
credentials? What does can really do anything? And checking with your healthcare provider to say, should I even be attempting this, or what's the story on this? Because if they've doubled and they're making this much money, and if no one is going in and policing them. Uh,
Yeah.
then I don't this is like to me the Wild West.
It is. It is the Wild West out there. And I think, kind of on that note, one of the big key takeaways for me is I just I don't feel the need to always be telling people what they should be spending their money on, right? Or,
Right.
I'm not a doctor. I'm not everyone's doctor. And so that's not part of how I want to live my life is by telling people like, yes, no, you should be spending your money on this, not that. But I don't feel like these companies should be allowed to lie or to suggest things that aren't the case in order to bring that money in.
Right.
So if people knew the truth about these companies and what was actually in the IV bags they're getting, whether that was actually indicated for what they're experiencing, if people were being truthful there, I'm not sure they would be bringing in the type of money they are. So
Yeah.
it isn't necessarily yeah, it's a rough question because you don't want to tell people like, don't worry about aging naturally or don't worry about
Right.
whatever, just because there's so much pressure to care about these things.
Right.
But if these companies aren't being truthful, they don't deserve our money.
Right. Okay. So we're going to check with our healthcare provider before we go,
Yeah.
check with our insurance if we decide we are going to go and know up front. But all I know, if it's like 100, 200, or $1,000, that's a heck of a lot of produce you could buy that we
Yeah.
know could really keep you quite healthy and has
Yeah.
antioxidants that could help with aging. So with that, Dr. Jesse, thank you so, so much for writing this
Yeah.
article and for setting us straight on medical spas and IB therapy. So thank you
Yeah.
again for coming on Spot On.